Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is avoiding surgery for degenerative disc disease. The normal intervertebral disc is composed of 80% water and 20% collagens and proteins. The analogy is that of a jelly donut. So you have the inner gelatinous region, which is called the nucleus pulposus, and the harder outer region, which is called the annulus fibrosus. There are nerve endings out here. Okay, so you can feel pain if you have a tear or a problem in the annulus. The nucleus has no nerve endings at all. The disc itself is a great shock absorber every time we walk, jump, and run. The degenerative disc disease occurs when the disc starts to lose content. Basically, it starts to turn into a prune. Here you have a healthy disc. Here you have a disc that's starting to lose water and lose height. Okay, starts to bulge out, almost like a tire that's getting flat. All right, 40% of the time, the intervertebral disc is the cause of low back pain. Remember, when you have tears in the outer part, the annulus, there are nerve endings there, and it can cause pain. It can actually inflame adjacent areas where there's nerve roots and cause sciatica as well. Degenerative disc disease may lead to daily disabling pain, or it may be completely asymptomatic. There's a study, numerous studies that have been done looking at people who have no back pain at all between the ages of 20 and 50. Over a third of those have evidence of degenerative disc disease on an MRI. No back pain. Treatment options for degenerative disc start off with medications, and this may include simple over-the-counter anti-inflammatories and Tylenol. For short-term exacerbations, it may include narcotics. Also, topical prescription pain creams can be very helpful. Muscle relaxers can also help in times of need. Physical therapy is one of the cornerstones of degenerative disc disease treatment. This can help strengthen up the muscles around the low back as well as the abdomen and help relieve pain. Chiropractic treatment can be beneficial. TENS units, which are about the size of an iPod and have these foam pads over the back that can change the way the brain perceives pain signals. Spinal decompression therapy, which is what you see here, which is computerized intermittent traction, which has been shown to be over 80% effective for low back pain due to degenerative disc disease. Acupuncture can be helpful as well. When it comes to interventional treatments, trigger point injections or subcutaneous injections that are great for muscle aching and spasms. Intradiscal injections, such as you see here, which is when steroid is placed into the disc. There have been some studies showing that can provide months of relief at one time. A lot of times when the disc is degenerative, it shifts abnormal pressures to the back of the spine, the facet joints, and makes those painful. So those can be helped with medial branch blocks, facet injections, or radiofrequency ablation. If the degenerative disc disease is inflamed and it's causing sciatica pain, then an epidural injection can be very helpful. The IDET treatment, which is intradiscal electrothermal treatment, is not done very often anymore because insurance companies don't cover it. And then the mild treatment is a minimally invasive lumbar decompression. That's a great treatment. It actually takes some of the disc out and helps relieve pain. Here's a radiofrequency ablation for the facet joints in the back of the spine. These tiny little nerve endings, called medial branches, what this procedure does is it deadens those, okay? And that can provide pain relief in the low back for anywhere from 6 months up to 18 months of consistent relief, and it can be repeated as necessary. Additional options that are new include stem cell injections. These can be taken from your bone marrow, which is, you can take from the iliac crest around your hip, immediately processed and put into the disc. There's some initial study results showing this works actually very well. You can also use amniotic-derived stem cells. Platelet-rich plasma therapy works well. All these fall into the realm of regenerative medicine, which is an attempt to repair and regenerate the disc. The disc itself has a very low metabolic activity and a very low propensity to heal itself. This can kind of put growth factors and stem cells in play to help further along the regeneration process for your disc. Comparison of long-term outcome for patients with back pain who had a discography that they call concordant did not demonstrate a significant difference in outcomes measures of pain, health status, satisfaction, or disability on whether or not surgery was done or not. Okay, 75% of the time, patients are able to achieve a satisfactory level of baseline pain and avoid surgery with degenerative disc disease. So think long and hard before undergoing surgery if you have degenerative disc disease, because a lot of times intensive non-operative treatment ends up producing the same result or better, and you haven't had the risks of surgery. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several affiliated clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.